American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate offices is endangering children, including thousands of children in Milwaukee. If you have a proposal to make these programs work better, present it and justify it. Mr. Secretary, you will say that you have to fire thousands of employees and eliminate programs like LIHEAP because our deficit is too large. But you won't mention that at the same time this administration is proposing these cuts, it's proposing tax cuts for billionaires that will add trillions to our debt. You are cutting programs and firing staff with no plan and no understanding of what the department you are leading even does for the American people. And that's why you had to rehire staff working on the World Trade Center health program and screening coal miners for black lung disease. You fired everyone, and now you want to take credit for hiring them back? That's not how this works. Congress provided over $360 million on a bipartisan basis for NIOSH. You eliminated the entire Safe to Sleep program that the Eunice Kennedy Shriver Institute. Safe to Sleep is one of the most successful child safety campaigns in history that prevents 1,500 babies from dying each year, at a time when we are seeing rates of SIDS starting to climb. Without staff, these programs are meaningless, and this is happening across HHS. I could go on and on about how this administration's careless and reckless approach is hurting the people of Wisconsin and this country. These are just a few examples. Mr. Secretary, this committee has worked in a bipartisan manner to improve child care options for working families, address the substance use disorder crisis, support seniors and people with disabilities so that they can live in their communities, and to make the United States the leader in biomedical innovation. You're implementing changes right now that are dismantling our progress, and you're hiding it from Congress and the American people. We don't need to just reject this budget request. We need to reject what's happening at HHS right now. We need to do that before you have caused irreparable harm at the department and the programs it administers that millions of Americans rely on. I yield back.
Thank you. Secretary Kennedy, we welcome your opening statement.
Is it on now? All right, thanks. Thank you, Chairwoman Capito, and thank you, Ranking Member Senator Baldwin, and all the members of this committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, we aimed to make America healthy again with a special focus on chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs for taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developing nation, despite the fact that we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong. All the money that we've been pouring into these programs for years has not resulted in better health for Americans. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, veterans, American Indians deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary health care physicians. We will prioritize these families, especially the Native American and Alaskan communities. Protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulation, inspection, and education to remove harmful chemicals from food and packaging. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs, as we did last week when we approved South Carolina's application for support for a program, the first program in the country that provides cell therapy and gene